Welcome to Healing at the Speed of Light. Every week we discuss how laser therapy is changing healthcare and how you can benefit. Now here is your host and founder of Laser Therapy Institute, Dr. Jason Rountree.
Thanks for joining us again here on Healing at the Speed of Light. My name is Dr. Jason Rountree, and I'm going to be your host again today, but I'm joined by a very special guest. Dr. Andrew Hall from California is joining us on the show today. We're going to be talking about a condition called Idiopathic Pulmonary Fibrosis. Now, Dr. Hall has really been on the forefront of learning about this disorder and how laser therapy can be used with some of these symptoms. Dr. Hall's a 1975 Palmer graduate, and there's a couple of websites you can check into if you're interested in learning more about him and this condition as well. You can find him at summit-chiropractic.com. And you can also find more about idiopathic pulmonary fibrosis in particular at ipflaserstudy.com. And we'll throw those links in the show notes as well. But Dr. Hall, thanks very much for joining us today. I really appreciate you taking the time to be with us, and looking forward to hearing what you have to say.
Well, thank you, Dr. Rountree. It's a real pleasure being with you today.
So I know because I've talked to you in the past, and just kind of looking into the world of idiopathic pulmonary fibrosis, this is not just a really common disorder, but you've had a kind of personal experience with this.
I did. I will give you a little background. About 7 years ago, I developed a cough, and the cough seemed to get worse and worse and worse. And I found myself having coughing fits. I would wake up in the middle of the night having these terrible coughing fits. I would be in the office with patients having coughing fits, and it got to the point where it became so bad I decided I better go to the doctor and find out what the heck is going on in my chest. This can't be just allergies anymore. I kind of passed it off on allergies or whatever, but as it turned out, I went to the pulmonologist, had a CT scan, did a pulmonary function test. He sat me down and said that I've got some bad news for you. You have idiopathic pulmonary fibrosis. Your prognosis is very poor. He says, I expect you to be on oxygen in 4 years, and you'll likely be dead in 6 years. And so that's what started it all. I have had a history of lots of laser work. You know, I have credentialed doctors for class 4 lasers, and I've taught a 3-hour PowerPoint program, many seminars. I was very well versed in class 4 laser therapy, and I decided, I did all this research to see if I could find any research that was done on pulmonary fibrosis with laser. There was absolutely nothing. And so I thought, well, I know it helps with oxygenation, reduces inflammation, edema, and on and on. And I thought, I'm going to just try this on myself. I'm just way too busy to die in 6 years. This is not going to work for me. So I started using laser, and sure enough, subsequent pulmonary function test, I had actually improved. And my pulmonologist said, gosh, I've never seen pulmonary fibrosis ever improve. You get worse and worse and you die. And then months and months go by. I had another pulmonary function test. Same thing, it had yet improved again. And he was, curious. I kept telling him, well, I'm using laser therapy. And finally, after the 3rd or 4th visit, he said, I need you to tell me about this laser stuff, because I'll be honest, I know nothing about it. And we had a very long chat about all the photochemical processes taking place and all the reasons why I was doing so well. And so what I did is I was on another website, and there was regarding some natural healing. And I described my situation, what I was doing with laser for pulmonary fibrosis, and I started getting these phone calls and a bunch of emails, people with pulmonary fibrosis that wanted a referral. And come to find out, after about 18 of them, they all had the same results I did. Because at first I thought maybe this is just a fluke. Maybe I'm just lucky. And then I figured out that we're really onto something here. That this is really quite remarkable. And so I decided to start a study because there just were no studies, and we need some statistics. We need some hard facts on this.
Yeah, no, that's exactly right. That on this podcast, we really hit the research studies hard, because I think that's going to be a really good way to expand the use of laser therapy. You got to be able to show that it works by research. Anecdotal examples are really valuable. However, not something that as medical professionals you can really rely on. So having some good studies, some good research is a pretty critical piece.
Absolutely. Yes. And I have just literally got stacks and stacks of research papers. And in fact, since I was diagnosed, now there's been a number of research studies done on IPF, and some of them done with a mouse model. And there's just a whole lot of studies that have been done. And I've just collected all these studies. I've got a huge stack. And I think that anecdotal results are important, but I think what we really need is we need scientific facts on this. So the thing is with pulmonary fibrosis, you're looking at a condition that is always fatal. There is no cure. There are a couple of anti-fibrotic drugs on the market. You've got OFEV and you've got Esbriet. They have pretty bad side effects. It is extremely expensive. I think it was $9,000 a month for Esbriet, and OFEV, wow, I think is $1,000 a month cheaper. But those are anti-fibrotics, and what they do is they slow down additional fibrous tissue being laid down in the chest. They don't cure the disease, and we're still hoping for a cure someday. And I've got to tell you that we do not consider laser therapy for pulmonary fibrosis a cure. It is not a cure. And not all patients respond to it either. However, of the nearly 350 patients that I've referred to laser therapy, I've only heard from 3 or 4 that really claim that they really didn't get any subjective or objective positive change. So really the results have been astoundingly good for laser therapy. But again, we need research on this. We can't just go by anecdotal study.
Well, and I think that's something that is pretty neat about laser therapy, is that there are pretty much no side effects. There's really not nearly the risk levels that you have with some of the medications that you talked about. So being able to study this, these patients within the study, they really have nothing to lose. Either they get better or they don't.
Absolutely. They have nothing to lose. And the other thing is too, not only are there no side effects, but the cost is reasonable. People can afford, especially when you go on from the initial program that we have outlined for patients. I continue with weekly laser treatment. And I'll be honest with you, even the last pulmonary function test I had just a few short months ago, we're talking 6 years later, I'm supposed to be dead by now. And my last pulmonary function test, most of the aspects of that were still better than the first one 6 years ago. And again, I don't use OFEV or Esbriet. I use laser therapy. I don't use any meds. And the other thing that is really great is that with my study, what I'm finding is that laser therapy is arresting the progression of the disease. And I feel very strongly that pulmonary fibrosis patients get on laser therapy as soon as they get diagnosed. We find that the late stage patients don't respond nearly as well. And I think that it's much like any other fatal disease or serious disease, whether it be cancer or whatever, the sooner you get started to take care of the problem, the better. And this is certainly the case with pulmonary fibrosis.
Yeah.
So the early stage patients respond much better to laser than the late stage patients.
So what should patients be kind of looking for to try and catch this in the early stages? You know, if maybe they have that persistent cough and they're starting to get a little bit concerned, what can they, what should they be doing? And is there something they can describe to their doctor about what's happening that would help to get a good, accurate diagnosis?
I think what they need is they really need to be evaluated by a pulmonologist. I think that many of the medical doctors, you know, your family doctors, they're not that well versed in pulmonary fibrosis, and they are not really qualified to make that diagnosis. And I really feel that, you know, patients with a persistent cough, sometimes what will happen to is you get muscle aches or joint aches, weight loss. You will start to get clubbing in the fingers like I have. And, you know, you need to have a pulmonologist really evaluate you to get a diagnosis. So there's you know, pulmonary fibrosis is an interstitial lung disease, ILD. And that is kind of a blanket term for a whole number of lung diseases, whether it be hypersensitive pneumonitis or usual interstitial pneumonitis. There's a whole number of interstitial diseases, and a good pulmonologist can do what it is exactly that you have. My study is on IPF, mostly because that's what I've got, and that's where my big interest was. But there's been an awful lot of patients with HP or UIP that have used laser therapy, and again, with in many cases, phenomenal results. So, you know, I just feel very strongly that patients go to a pulmonologist to get a proper diagnosis.
That's great. So make sure that, you know, if you're concerned about that condition, that you're asking for that referral to a pulmonologist. And yeah, like you said, Doc, you know, this is within a family of disorders, and the mechanisms here are kind of that chronic inflammatory response that end up creating fibrosis within the lungs. Fibrosis tissue, fibrotic tissue, is tissue that's unhealthy. It doesn't stretch, it doesn't flex like healthy lung tissue does. So you end up being able to pull less and less air into the lungs.
That's true. And one of the things too, now with your classic IPF like I have, the fibrous tissue forms in a honeycomb pattern. If you were to look at my CT scan, it looks like a hive of bees were in my chest. It looks just like honeycomb. Now, there's always exceptions, and there's some IPF patients that they don't necessarily have the honeycomb pattern. It doesn't necessarily start on the bottom and work its way up like mine. Sometimes it'll be mid-lobe, and it won't be necessarily in a honeycomb pattern. But again, this is where a pulmonologist is going to be able to figure all this stuff out. But what I also have found with the laser is that it helps to soften the fibrous tissue. So of course the fibrous tissue is very stiff. Sometimes you don't get the chest expansion and contraction while you breathe because of the stiffness of the tissue, and the laser will help to soften that up, among a whole host of other things that the laser does, which we can talk about.
Yes, you know, we've in this show we've gone over mechanisms of laser a good bit, but like you said towards the top there, Doc, you know, a big function of laser is producing better oxygenation of the tissues, and that is so critical in the lungs, especially if you're going to have healthy lung function, that we get good oxygen delivery in the first place. But we also know that laser therapy can improve local circulation, as well as improve the metabolism of cells in that area, leading to improved tissue health. So,
absolutely. In fact, let me just review a few things that the laser does. You know, we can make a blanket statement to say, well, you know, laser reduces inflammation and helps with any edema, and that's great. However, let's get a little bit more detail. It increases the ATP production, and this is really helpful in the healing of the alveoli in the lungs. Decreases the interleukins, which start and maintain the inflammatory process. Stabilizes the cell membrane in the alveoli. Increases the SOD levels, the superoxide and of course that's an antioxidant, and that reduces the oxidative stress. Enhances the microcirculation in the lungs. Increases the nitric oxide, which of course is going to promote better oxygenation. Decreases the bradykinin levels, and of course that contracts the blood vessels in the chest. We don't need that. Again, it'll soften the fibrous tissue, increases the macrophage activity, which helps to get rid of cellular debris and any particulate matter that happens to be in the lungs as well. So and that's not a complete list. There's a whole host of things that the laser is doing, and this is something that you're not going to find with antifibrotic drugs. We have to ask ourselves, well, why do we have the fibrous tissue forming in the first place? And it's primarily due to the inflammation. So when we can reduce the inflammation, we're going to see an arrest of the progression. In fact, with my study, what I'm doing is people who have started laser therapy after their diagnosis, what we're seeing is that they are not getting more fibrous tissue laid down in the chest. It seems to be arresting that. Plus the fact that with the increased oxygenation, these patients have better stamina. A few cases, there's I hear from patients just almost every day, and I have got reports of patients that, gosh, I couldn't walk for more than 5 minutes, and now I'm up to an hour and a half. Or I couldn't even make it up the stairs in my home, and now I can go up and down, and I'm not even out of breath when I'm up at the top of the stairs. And this is, hearing these reports, it's just very satisfying to me that these people have regained function in their life. And again, it's more prevalent in the early stage patients. The late stage patients, they're pretty far gone, and because the laser is not actually taking fibrous tissue out of the chest, we can't call this a cure. And if it did that, I'd say, we've discovered a cure here, but it's not a cure. And because the late stage patients, they still struggle. And this is why I feel very strongly about the early stage patients getting in on laser as quickly as possible. It's going to prolong your life.
I think something I've heard from patients before too is trying to catch us in the early stage. They'll say, "Hey, I had a chest X-ray. Is that good enough for a diagnosis? Does that help rule this out?"
No, I think a chest X-ray is going to be helpful, but I really think what you need is you need a CT scan. You need to have a pulmonary function test, and with a pulmonary function test, they can look at the numbers and say, well, oh, you have COPD, or you have some other lung issue. They can kind of narrow that down depending on what they find with the different numbers, what they're looking for in there. Of course, with a CT scan, then you're looking at the honeycombing, or what they call the ground glass opacity in the chest. And some of the patients, they'll have the ground glass as opposed to the honeycomb. And but again, it just takes a qualified pulmonologist to figure that out. And that's why I feel very strongly that patients with a real chronic cough, they have some of the other symptoms, they really need to go get themselves diagnosed and find out exactly what the heck they have.
Yeah. Yeah. Really, really pushing for that referral to the expert, to the specialist there. Good. So, we've talked, you mentioned your study several times, and I'll say the name of the website again there. It is ipflaserstudy.com, and you can go there. There's actually some fantastic, easy to understand information about the process of this fibrosis. Also, a way for, I believe, patients to sign up to be a part of the study. So that's a good place to go. What about those who are listening, who are physicians, who are doctors, and who are interested in what you're doing with this study? What should they do to learn more?
Again, they can go to the websites that I have. You can learn an awful lot from that, and that's one of the main things. I'm always available, especially with email. If they have any specific questions, I'm always available to answer anybody's question. I've helped literally hundreds of patients to locate a provider with a class 4 laser. One of the things, let's just discuss lasers for a moment. We have had patients contact me that say, I've been going to this provider. He's got a class 3 laser, and it just doesn't seem to be helping at all. And then we'll find them a provider with a class 4 laser, and lo and behold, they start responding to care. I don't like knocking other lasers or whatever, but a class 3 laser really does not have the power to get the fluence in the lungs for the dose that we really need. I am a huge proponent of class 4 lasers for pulmonary fibrosis. And, again, I try not to single out any one laser. I've got my preferences, but it definitely requires a class 4 laser. And we have seen this on numerous occasions, that the patients who started with a class 3 laser, you get some 30 milliwatt laser or something, it's really not doing the job for the patient. And I think that for doctors who are shopping for a laser or they want to trade up, you really need to do your homework. And one of the things that I would look for in a laser for a doctor is to make sure that you have good power. We recommend a minimum of 10 watts. The other thing is that you want to look at the wavelengths of the laser. Wavelengths can be very important. The other thing is that I also feel that you want to look for a laser that you can modulate at specific frequencies. Our protocol, for example, we change the hertz throughout the treatment program. We have that actually programmed into the laser. And for example, for the lungs and bronchi, it's 727. For optimizing cell activity, it's 2128. So many lasers can't do that, and I would really look for a laser that you can program. There's been Dr. Rountree, I know you've been in the laser game for a long time, and we have used very successfully lasers for all these musculoskeletal conditions and neurological conditions like Bell's palsy, and we've all seen wonderful results from this. But now laser has evolved where we're looking at life and death situations, whether it be pulmonary fibrosis, even COVID-19. Now they're using class 4 lasers for COVID-19 in many countries, and I would love to see it used in the U.S. I'm not going to hold my breath for that to happen anytime. But we do have a bit of a medical politic problem in this country, and But I feel strongly about the lasers that are used, and it definitely requires a class 4 laser.
Yes, and I think I think if we've got listeners who have heard a number of our episodes, they'll hear me kind of push into that. Class 4 laser really has the best chance of getting that therapeutic dose of light deeper into these tissues. Something superficial, not so critical maybe, but for these deeper tissues like the lungs or the brain, you really have to have a high dose. And I will put in a little plug for Laser Therapy Institute, saying that all of our clinics that are members of Laser Therapy Institute do have the type of lasers that Dr. Hall is talking about right now that are programmable, high-power devices, really at the top end, because those do seem to have really the best effects from what I've seen as well.
Well, absolutely, and I appreciate everything that you folks are doing, and again, I think that for doctors who are looking for a laser, you really do your homework, and if you need some help and some direction before you buy a laser, one of the things, and I don't want to take too much of your time, but when I was teaching laser therapy, I would ask for a show of hands. Well, who's using laser in your practice? And it seems like a lot of the doctors who had wimpy class 3 lasers, they ended up on the shelf. And the doctors who were getting the best results and were happy with the results, they had a good class 4 laser. And if you're going to spend thousands of dollars on a laser, get a good laser. And this is one of the things that I have really stressed at seminars that I was teaching. Get a good laser, and I promise that you will get a return on your investment. It may seem very pricey at first, but you will get a return on your investment, and you're going to be very happy with your results, and your patients deserve it. And now that we're dealing with serious problems like pulmonary fibrosis or even COVID-19, serious problems require a serious laser. And don't be cheap. Do your homework. And again, if you need some help and direction or advice on that, I'm always available to offer my opinion.
Well, I love that quote. Serious problems require a serious laser. That's fantastic. Yeah. Well, Dr. Hall, thank you very much for your time today and for your sacrifices, really, and all your work that's gone into this and being able to help hundreds of people with this very serious condition. I think, having a little bit of hope, again, not to promise a cure, but to be able to arrest the progression of this really serious condition and improve some of the functional markers is just so encouraging to be able to look at. So again, to get a hold of Dr. Hall, you can go to IPFlaserstudy.com, and very, very kind of you to be able to offer your assistance.
Sure. And those people who would just like to email me directly, Dr. Hall at summit-chiropractic.com. I'll be happy to communicate with anybody who's got questions. So it's an absolute pleasure being with you today, Dr. Rountree, and I appreciate you asking me to join you.
Well, thank you so much, and we'll hopefully talk again soon.
Okay.
Good.
Have a wonderful day.
Thank you.
Subscribe to this weekly podcast for more great information. Find a certified laser therapy clinic near you at lasertherapyinstitute.org. If you're a healthcare provider, check out our practitioner-focused Laser Therapy Institute podcast.